It's 12:30 and a good afternoon. Brian Dust, how you doing?
We are purely loving our music here on KJ.
I'm having a good time. I'm doing great piano rock songs. And I have had,
There's too many.
I may have to do it again tomorrow because I've
Yeah.
got so many requests I don't even know what to.
Oh.
And I
yeah.
was over here and I was singing a little Elton John,
What?
Crocodile Rock. and
Let's hear it.
the gals from the Pelvic Health place
Yes.
said they were hoping I was live on the radio because I was
Oh.
so good, right?
Exactly. That's exactly what we
Oh,
said.
we can make this happen.
I was just doing the la 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 la. Anyway, everybody else is glad it wasn't on the radio.
Oh, my
Anyway,
goodness.
but it's good to have you here. Facebook Live in it right now. And Dr. Kyla, Dr. April's here. And we're going to talk about things happening at your place.
Yeah.
Effingham Pelvic Health and Wellness. She has it on her shirt today.
Oh.
Always repping.
Oh, absolutely.
Really?
How you guys doing? Been busy, I guess.
Yeah, we're doing great. I was just saying that we have had 4 weeks of events back to back. So tomorrow night is our last event we're having at the clinic for a couple weeks. Yeah, and then we want to say thanks to everybody who came out for our open house last week. We celebrated our 2-year anniversary.
How'd that go? Well?
Yeah, it went really
good.
well, and we just have. I feel like we have a huge support here in Effingham. I just feel like Effingham in general is very open to new businesses, and I'm part of the Chamber of Commerce, BNI, different organizations, and I just feel like the past 2 years have flown by, but I've had fantastic support from other people in the community. So
I think they're very open to new things as well and new things to talk about on the radio like we have.
yes,
Yep.
yes.
And new experiences like that because nobody ever talked about radio stuff like this on the radio before around here.
Yeah,
Yep.
we
It's true.
appreciate you guys letting us talk about pee and poop and
All the
all the
things.
things, sexual intimacy, and
You
Much
name
more.
it, we'll talk about it.
much
It's all right.
more.
We were going to start by kind of talking about some of the things that we had treated this week or things that we have seen
Yeah.
pretty
Yep.
commonly in our clinic this week. We've been treating a lot of pregnancy and postpartum. I've been seeing a lot of that. I think Dr. April has too. We like to see moms. If you're doing well, we see you once a month during pregnancy. But if you have any symptoms, we'll increase that frequency. We just like to keep you. Pain is not normal during pregnancy. You shouldn't be told, like, well, you're just pregnant. That is not the case.
You're just pregnant.
You
Yeah.
can be pain-free through your pregnancy. And that's one of our passions is making sure women feel really good through pregnancy and then also having the best labor and delivery that they possibly can. So we do a lot of birth prep as well. We do see Dr. April does see kids. She helps them with bedwetting and bowel issues. So we both see males. So we treat males for core and hip strengthening things, any kind of pelvic pain, urgency, prostate issues, things like that. We see a lot of males for that as well.
Busy, you see, I mean, anybody who's having any kind of symptoms, any on your body down in that general area, you're pretty well there to help them get through this and make it better.
Yeah, and we say too, it's not just like what you think of like bowel issues or bladder issues too, like low back pain, hip pain, low abdominal pain, like all of that is connected with the pelvis. So if you've seen other providers and you're not getting better with your back pain or your hip pain or abdominal pain, come see us because most times people who come into our clinic have not been approached by the approach we look at it from. So looking at how the pelvic floor is coordinating with all of that, a lot of times the pelvic floor is completely like left out. Nobody wants to talk about that area. But there are muscles in that area that affect the back, the hips, abdominal issues. So a lot of people.
They don't want to talk about it, but we all have them.
Yes,
True.
It's
exactly.
like, come on now, it's just our bodies. We all have these issues and we all have these areas. So we might as well get to the root of the problem.
A lot of times people like want to kind of put it on the back burner, not think about it until they're like, all right, I can't deal with this any longer.
yeah.
So we always say it's best to take care of it right away. You're going to get better faster. You're going to save money. You're not going to need to see us as long if you come in right away versus if you let it go for years. It's going to take longer to get
absolutely.
to optimal recovery.
Yeah,
Yeah,
I actually
so-
had a patient yesterday who came in and she was like, she apologized because she felt like she was taking my time because she didn't have any symptoms. But I love treating patients who don't have outwardly symptoms because she was postpartum, so she had core weakness, pelvic floor weakness, all those things, but she wasn't having symptoms yet. She would have within a couple of
Yes.
months or
you
even
said
a couple
yet.
of years.
Yet is
Yes.
the operative word there.
Yes.
Yet.
So she had seen me before and she kept saying like, oh, I just feel like I'm going to take your time away. Like I don't need to be taking a spot here. But she really did. I mean, she had things that needed to be fixed and now she's going to be able to go through postpartum being pain-free and not having symptoms.
That is an amazing
Whoa.
thing to talk about
Yeah.
because I'm not going to go to the doctor. I don't want to go see the doctor. Well, it's going to save you a lot of time and punishment and all that stuff.
Yes.
So go get it taken care of.
And we always say wellness is the best. Like preventative care is the best. Unfortunately, with insurance-based medication or insurance-based medicine, we're not a preventatory. Like in the U.S., we just don't take care of prevention. It's all like once you're sick, we take care of you. But in our clinic, we really do like to focus on that prevention too, because like say that mom wants to have more kids in the future, or when she hits menopause, that's when a lot of women start having issues, and they're like, oh, that stemmed back from childbirth when I had that perineal tear. So yeah, preventing stuff now, even if you're not having symptoms, if you know you have core weakness and things, it's always good for our bodies to be stronger and healthier.
I like that idea. Now, you mentioned something about urologist and you guys may go different ways on how you do some stuff, but you know, what's the differences? What's the same things that you guys can take care of? I'm kind of curious about that.
Yeah, so we always recommend an interdisciplinary approach. So that means that you're seeing different providers, and different providers do different things. So it's not a bad thing to have several people on your team, especially if they're all communicating. So we're very open to communicating with other providers. We always are reaching out, asking them what they think about what we're doing with our patients and things like that, just to make sure we're treating the whole patient. But a lot of patients aren't told about pelvic floor PT and like how beneficial it can be for them. I have seen many patients that have had surgeries, prostate surgeries, pelvic surgeries, things like that wish they would have tried pelvic PT first, and they wish that someone would have told them about that first. So that's something we're really passionate about, is just making sure that people hear about us too, and that we're an option that people can go to before they just jump straight to a primary care or a urologist or things like that.
Yeah, so we, as physical therapists, we are very, we're conservative based. We are not going to, like, give you medications. We're not going to give you, we can't do medications. We can't do surgery.
Yeah, give me a scalpel.
Yeah, we can't do that. You don't want us doing that. But a lot of times that is we always say, like, what's in the provider's toolbox. So urologists, and that's what's in their toolbox is medications and surgery. What's in our toolbox is conservative treatment and addressing the underlying issues, and not just not just giving a medication to cover up the symptoms. So there is times when you definitely need to see a urologist.
Sure.
So if there's blood in your urine, you're having UTI symptoms, kidney stones, if there's concern for potential bladder cancer, that's a fantastic time to see a urologist. But if you're just having urinary urgency, overactive bladder, any type of urinary leakage, a bladder prolapse, if you're going to have a prostate surgery, come see us before and afterwards, because a lot of times, like Kyla said with surgeries, the surgery may need to be done. There are times when surgery has to take place, but they're not told about the side effects that can come. And then when they do have side effects from surgery, whether it's prostate, hysterectomy, prolapse repair, and there's now dealing with urinary leakage issues afterwards or pelvic pain afterwards, a lot of times they're dismissed by their provider of like, oh, just give it a couple more months, it'll get better. That's when it's a great time to give us a call, and we can start treating you right away, because it is never normal past the first few weeks of a surgery to be dealing with urinary leakage issues or pain.
And I see a lot that they recommend a surgery again. It's like, okay, we did one surgery, let's do another to fix your symptoms now. And people, I have a patient right now, he's on his like third surgery, and symptoms are still not better. And now that he's seeing me, he's like, I wish I would have done this before my first one even, and maybe my symptoms or my outcomes would be different. I can't tell him that they would be different, but it's likely that he would have better success with his surgeries if he would have been doing pelvic floor PT along with the surgery.
Yeah, and we do have patients that come in that are told that they need surgery and they want to get a second opinion, so they see us, and we are very honest. Like, we're not going to tell you that you need to be doing therapy if we do think you need a surgery. So for like prolapse, which is when like the bladder, uterus, or the rectum start to fall into the vaginal canal, if it is coming out of the body, I know that's a lot for the radio.
Yeah. I'm glad it's not TV.
On Facebook.
Oh,
But
it is on Facebook.
it is
All
on
right.
Facebook, but like if you feel like there's an egg down on the area and it's coming out, typically at that point it is more of a surgical, like we can't put that back up into you.
Yeah.
That is more surgical, but we can help with the symptoms and eliminating symptoms. So if somebody's not a surgical candidate or they're terrified of surgery, we always say come in, see us, and we can help get your symptoms better. But we are going to be honest with our patients and tell them if we do think a surgery is needed. So we're not completely against surgery, but we do think there's a lot of surgeries that are done that don't need to be done. And if they would have just done some PT beforehand and optimized their strength or their flexibility throughout the low back, hips, and spine and the pelvic floor, it'd be better.
I like that.
And you guys always have some great terminology. We always learn a few new things. Of course,
correct.
The things that aren't always talked about, like you said, with leakage and prolapse, and now you got a new one. I see. Nocturia? I don't know how you say that.
Nocturia.
That
Good
sounds
job.
like a scary
Nocturia.
movie name.
I know.
That just means peeing at night. So, if you pee a lot at night, that is also something that we can help with. So it's typically people aren't coming in just for that. They're also having like urinary leakage issues. But then we ask them, how many times are you getting up at night to go to the bathroom? What do you guys think is normal?
Well, I generally don't. So,
That's
but,
good.
But only time I do if the cat jumps on my.
You wake up?
Yeah, and she'll wake me up.
We don't
and
always
it's like,
count that.
while I'm up, I might as well go. But I
Yeah.
really don't have that problem. So I'm guessing probably 0 is the optimum, right?
0 to 1.
0 to
0 to
1.
1.
Okay.
Yep. So then once if you're over, I think it's 65, like about 2 times a night can be normal too. But any more than that is not within the normal range. So we do treat nocturia as well, so peeing a lot at night. But that's also something we work with an interdisciplinary approach. We will have them go get tested for sleep apnea a lot because if that's like one of their only symptoms, getting up a lot at night to pee and sleep apnea go together. So we will refer them out to like sleep study doctors.
Interesting.
Which I have. And it's the
Good.
best thing I ever did was go get a sleep study.
Okay.
I can tell you a
And
lot.
it has been a game changer for the past 15 years or something.
Yeah.
Yeah.
It's amazing. So
Yeah.
if you are dealing with that, you don't have to deal with that. Get it taken care of. It's so much better.
Correct.
Yes.
Yes.
Good deal.
One other thing I just wanted to mention too is we had a patient recently who was seeing urology every couple of months for a procedure in the office, overactive bladder peeing every 30 minutes. Urology in her 10 plus years of seeing them never once told her about pelvic floor physical therapy. Her primary care doctor, Dr. Tina Razine, actually mentioned to her, why don't you go try to do pelvic floor physical therapy? And she came and she's now not having to see urology as often,
Oh, wow.
which they
Good for
probably
her.
don't like that. But for her, she's not having to have this procedure as often anymore. And she's going pee the normal every 2 to 4 hours now. And then another treatment that they will do sometimes in the office is they put this needle into a nerve to help reduce urinary urgency. So if you're peeing all the time, but then you
Yeah.
have to come in on a frequent basis to get this needle put in the nerve, and then you're being billed for it. We can do the exact same thing in our clinic. We teach you how to do it at home. It's not a needle in the nerve, it's just electrodes on the skin. Research shows it is just as good, if not better. And we have people get a home unit for about $40 and they do it at home. So they don't have to go to a doctor's office. They're not having these weekly bills that they're having to pay
Sure.
for.
Oh, yeah.
So just there's a lot of different things out there that people don't realize pelvic floor therapy can help with.
Awesome stuff. So you guys got anything going up? You said this last week here, before you take a couple of weeks off from doing extracurricular activities.
Classes, yeah.
What do you got
Yes.
going on?
Tomorrow night is a free class. It's at our clinic on Thursday, November 9th. It's Midwifery 101. So 2 local midwives, Deborah and Tiffany, they are with Labor of Love Midwifery. They're coming and they're going to be talking about home births, the pearls of midwifery, and just ways to improve for all women, even if you're doing a hospital birth, ways to improve your labor and delivery experience. So the last time to register for that is tonight, but you just go to our Facebook page. It's free class. We just need to know if you're coming or not. So go to our Facebook page, Effingham Pelvic Health, and you can register through a link on there. And then we are doing free screens for the month of November. So we had some this morning. A lot of them are full, but we still have like 2 spots left on Thursday, November 16th. And then Thursday, November 30th, we are also doing free screens. And this is for a pelvic floor questionnaire, looking at any C-section scars, your hip pelvic alignment, as well as looking at diastasis rectus, which is like a core weakness issue. So when I do those, I'm not telling you like this is what we're going to be doing for treatment. I say, yes, you are positive for this. You do have this issue going on that could be causing your back pain, or no, that looks great.
Okay.
And then at the end, I give an overall recommendation of, yes, you do need an evaluation, or no, you're actually doing really good. Just keep doing what you're doing at home.
Very good.
Wow.
You're not going to pull like, well, I think your brakes need to be replaced and stuff like that, right?
No.
No, none of that. But I will say most of the
Give me
people,
$1,000. Your brakes need replaced.
most of the people we're seeing are coming in because they're having issues. So most of them
Absolutely.
do need to be seen.
Yep,
But
pretty common.
Awesome stuff. So once again, you got Facebook page and websites and stuff like that, and a phone number is.
go ahead, Kyla.
217-705-5077. And we are direct access, so that means you do not need a referral from your doctor to see us. All you have to do is just give us a call. Our patient care coordinator, Lori, she's great. She'll take all your information and give you all the information that you need to fill out before coming to see us. And we do have a website, Facebook page, and Instagram, and we also just launched a YouTube page.
Whoa, watch out.
So watch out for us on there. We're getting real crazy with it these days.
You'll be able to see this video on your YouTube page.
That's right.
If I remember, I'll send it to you.
Thank you.
All right, very good. Well, thank you both for coming in there. We appreciate everything you've done for the area.
Yeah.
You've made a lot of people's lives so much better. And keep doing what you're doing, okay?
Thank you for letting us
Thank
talk
you.
about it on the radio.
Yes.
Anytime. All right. Brian does talk to you on the drive home.
Sounds good.